Today's topic is about ectopic pregnancy. An ectopic pregnancy is a potentially serious medical condition in which a fertilized egg implants outside the uterus, most commonly in one of the fallopian tubes. Typically, a fertilized egg travels through the fallopian tube and implants in the uterus. However, in an ectopic pregnancy, the fertilized egg gets stuck and starts developing in the fallopian tube, cervix, ovary, or abdomen instead of the uterus. This is a dangerous situation as the fallopian tube is not equipped to support the growing embryo, and as it enlarges, it can cause severe pain and potentially life-threatening complications. Causes of ectopic pregnancy. Fallopian tube issues. Damage or abnormalities in the fallopian tubes can prevent the fertilized egg from moving into the uterus. This could be due to inflammation, scarring from previous surgeries, or infections such as pelvic inflammatory disease or congenital structural abnormalities. Previous ectopic pregnancy. Having had an ectopic pregnancy in the past increases the risk of having another one in the future. Pelvic inflammatory disease. PID is an infection of the female reproductive organs often caused by sexually transmitted infections like chlamydia or gonorrhea. PID can cause scarring and damage to the fallopian tubes, increasing the risk of an ectopic pregnancy. Endometriosis is a condition where tissue similar to the lining of the uterus grows outside the uterus. This can affect the fallopian tubes and lead to an ectopic pregnancy. Contraceptive measures. While rare if a woman becomes pregnant while using an intrauterine device, IUD, for contraception, the risk of it being an ectopic pregnancy is higher. Fertility treatments. Smoking, use of tobacco. Signs and symptoms. Abdominal pain. One of the earliest and most common symptoms of an ectopic pregnancy is sharp or stabbing pain in the lower abdomen. Vaginal bleeding. The bleeding can be lighter or heavier than your normal period and may be accompanied by abdominal pains, shoulder pain, pelvic pain, nausea and vomiting, weakness, dizziness, or fainting. Rectal pressure, pain on one side during bowel movements or urination. Diagnosis. Pelvic exam. A pelvic examination is often the first step to check for tenderness, pain, or abnormalities in the reproductive organs, especially the ovaries and uterus. Pregnancy test. A blood or urine test to detect the presence of human chorionic gonadotropin, a hormone produced during pregnancy. Quantitative HCG. This blood test measures the level of HCG over time. In a healthy pregnancy, HCG levels typically double every 48 to 72 hours. Slow rising or plateauing levels may indicate an ectopic pregnancy. Transvaginal ultrasound. It's the primary method to diagnose an ectopic pregnancy and determine its location. MRI may be used in complex cases or when ultrasound results are inconclusive. Laparoscopy. In certain cases where the diagnosis is uncertain or if immediate treatment is needed, a laparoscopy may be performed. Coldocentesis. This procedure involves inserting a needle into the space behind the vagina to check for the presence of blood, which may indicate a ruptured ectopic pregnancy. Hysterosalpingography. This is an X-ray procedure in which a contrast dye is injected into the uterus and fallopian tubes to detect any blockages or abnormalities. Treatment. Methotrexate. This medication is often used for early, unruptured ectopic pregnancies with lower levels of HCG and no signs of rupture. Surgical intervention. Laparoscopic surgery. This is the most common surgical approach and involves making small incisions in the abdomen to remove the ectopic pregnancy while preserving the affected fallopian tube. Laparotomy. In cases of severe rupture, heavy bleeding, or if the ectopic pregnancy is too large or in a location that cannot be accessed with laparoscopy, a larger incision may be necessary to remove the ectopic pregnancy and possibly repair the fallopian tube. Expectant management. If the ectopic pregnancy is very early, the HCG levels are low, and there are no symptoms of rupture, a healthcare provider may choose to monitor the person closely with serial HCG tests and ultrasounds to see if the pregnancy resolves on its own. Salpingostomy or salpingectomy. In some cases, the fallopian tube may need to be partially or completely removed if the ectopic pregnancy has caused significant damage or rupture. The choice depends on the extent of damage and the person's desire to preserve fertility. Follow-up care. After treatment, regular follow-up visits and HCG level monitoring are important to ensure that the ectopic pregnancy has been resolved and to detect any potential complications. Thank you for watching.